Contusions in medico-legal practice and sample MCQs. What are the learning outcomes? You should be able to define a contusion, mechanism of causation and along with types, and what are the medico-legal important aspects. First, let's get the simple meaning of contusion. Whenever you get any blunt force trauma onto your skin, there may be breaking of blood vessels leading into the extravasation, infiltration and coagulation of blood, but within the tissue spaces. So now I am going to highlight certain words within the tissue spaces and also without breaking your skin. So now you can understand it is an injury caused by mechanical impact or blunt force trauma resulting in crushing or tearing of tissues without skin break, where blood vessels rupture and blood escapes into surrounding tissues leading to extravasation, infiltration and coagulation of blood, but within the tissue spaces. So this is the basic definition of a contusion. When the amount of bleeding is more, we usually refer it as a hematoma. And what do you mean by an ecchymosis? It is a lesion which is resulted from non-traumatic bleeding, such as in a surgical therapy, maybe a surgical scar leading to extravasation of blood surrounding area, and also in older people there may be minor bleeding, which is termed as senile ecchymosis. Moving on to the types of contusions, the first thing that I want to emphasize is intradermal or pattern contusions, as you can see here. Pattern contusions, and also tramline contusions. You can see parallel lines, tramline contusions, and also contusions that resemble specific types of crimes, such as in case of sexual assault, child abuse, we are going to learn it. And also there may be internal organ contusions, such as in brain, lungs or anywhere, right? So it is not external only, you get internal organ contusions as well. And also bite marks, especially in the form of love bite, as you can see here. Let's learn about intradermal bruises. Before going into the intradermal bruises, let's think about a normal contusion. So that means, so this is the epidermis, this is the dermis, and this is the subdermal area, as you can understand. If a force is applied here, usually you get the contusion in this area. Alright, I forgot to tell that contusion and bruises are going to interchangeably use, not to worry about it. Right, so now because of the depth of the injury, you can't see very clear margins when someone is going to look at the contusion from there. Right, now moving on to another scenario where you get the pressure with an object with ridges and furrows, and also you get the contusion not only the fat layer or the subcutaneous tissue, instead you get the contusion in the dermis. So now two things, right? So here you get the force application with a pattern surface, and also it occurs in more superficial layers, that means dermis. As a result, you can see margins very clearly if one is going to look at from here. Right. So now we are going to learn it again. Now as you can see here, can you see something here? Is a very nice pattern there. Right. So this person had a fall onto a cemented floor with certain dust and certain sand particles. Now you can see a very nice pattern. So this is termed a subdermal or the intradermal bruise. Not subdermal, intradermal bruise. So now what's the medico-legal importance here? You can tell about the features of the causative weapon. And importantly, you have to understand now there are few features, right? So it is situated in the dermis, right? That's why it is termed as intradermal contusions. And also you can think about the causative weapon as well, and at the same time you can see certain pattern nature, that means ridges and furrows, to cause such kind of injury. The next type that we are going to learn is tramline contusions, as you can see here. You know tram lines, right? So two parallel lines. So what are the special points that we have to know? As you can see here in this picture, now with this rectangular object, now pressure is going to applied onto the skin. So because of the pressure, the blood vessels in this area is not going to get any break. But with the pressure applied here along the margin, what will happen? All the blood vessels get damaged on this area, causing bleeding on the both sides of the instrument. All right. So what are the shapes that you can get tramline contusions? As you can see, a roundish or a pole-like thing, or a rectangular object, all right, or maybe a pipe-like thing, right? So now this is the tramline contusion and the mechanism, right? So what are the medico-legal important issues? Can you think about the reconstruction? Yes, definitely. The direction, all right. So everything you can tell. And at the same time, another important thing, you have to get the length, the width of this area, and also length, obviously, all right. Now it is approximately similar to the width of the object, all right, or slightly, right. So like this, you can get some kind of idea about the dimensions of the causative weapon, all right. So now this area is similar to the width of this rectangular area, and also you can get the minimal length of the causative weapon as well, all right. And moving on to another pattern type of contusion, you can see a zigzag mark. So what does it mean? So this is a runover injury, right? So by looking at this runover injury, you can link a causative weapon by studying the tread pattern of this accused vehicle, right? So now this is one of the importance. Bruising of special significance, or contusions of special significance. Now have a look of this image. You can see certain patches like contusion. So any guesses? Right. So if somebody is going to tie this hand with great pressure, what will happen? There will be breaking of blood vessels, causing contusions. Now with this, you can reconstruct the incident happen. It could be a kind of attempted or forceful sexual assault case, or it could be a case of assault or tight gripping. And also it could, if it is applied to a child, it could be a case of child abuse, right? So now you can understand, we can predict about the type of crime that had happened by studying the special kind of contusions as well. If you can see the same contusions on the neck, it could be due to manual strangulation as well. Now we are moving on to another interesting aspect, appearance and color changes of contusions. However, this is not that scientific, but we have to study theoretically, right? A series of color changes can be observed in a contusion, which is somewhat helpful. It is not a conclusive one, but I want to highlight it is somewhat helpful for assessing the age of contusion. You all have got practical experiences. We all have got certain contusions during our lifetime. You have seen that there is a series of color changes that you can observe, right? It is not accurate, highly criticized. However, we have to learn certain facts, right? It is mentioned that the changes, the color changes begin from the periphery, not that important. However, so what's the colors that you get? It appear as red, it turns into blue, purple, black or green, right? And then finally it will turn into yellow, and finally it will be faded away. Right. And the next important thing, the bright yellow discoloration is considered somewhat accurate, right? So it's not again a very good thing parameter, however it is somewhat accurate to tell if you can see yellow color on a contused area. That means the contusion had occurred more than 18 hours earlier, right? Let's observe the different colors here. Can you see certain colors there? So what are the colors that you can see there? Right, so here you can see greenish bluish color, right, vague yellowish color, and also pinkish or purplish color, right? So not obviously red. When it comes to here, right, so you can see very obvious yellow color here and purple color along with very vague yellow color and also green color as well. Right, so now we are going to learn about a very rough guide to color changes in uncomplicated small contusions in a normal young person. Right, so immediately after the contusion, it appears as red because of the oxygenated hemoglobin. And then 1 to 3 days, right, so very vague, it turns blue or purple because of the reason of deoxygenated hemoglobin. And then by the time 2 to 5 days, bluish black. The reason is hemoglobin is going to break now. 4 to 7 days, it turns into green due to the conversion of hemoglobin to biliverdin. And then by the time 7 to 10 days, it will be come into a yellow color contusion because of the bilirubin. Now you can understand hemoglobin is going to digest or to break into a series of colors, and you can see the same color change on the skin as well. Now by 3 to 5 days onwards, you can see hemosiderin, but you can't see any hemosiderin, so this is a microscopical appearance. However, by the time 10 to 14 days, it will fade. Factors affecting the appearance of a contusion. Now, so these are the medico-legal important aspects. Now, the appearance and the prominence of a contusion vary very widely. Therefore, the force required cannot be precisely determined. Now, when we go to courts to give evidence, if one is going to ask, doctor, tell us what would be the force applied here like? Actually speaking, most of the time I can't give a precise answer. The reason is, as you can understand, there may be lots of human biological problems, maybe bleeding disorders, right? The age and also with the gravity, the bleeding will change into other places. So as a result, right, so there are many factors. It's not like in abrasion. Abrasion, it's here, that's it. But when it comes to contusion, it's not so. Right, so now we are going to discuss about important medico-legal aspects, right? So the appearance and prominence is highly unreliable to tell, right? And the contusion occurs due to leakage of blood from vessels, and it requires space for blood to accumulate. Now, if the force is applied to a place where you get lots of lax tissues, obviously the size of the contusion will be very much larger than the applied force because of the space. And also, now if the space is very dense tissue, such as in palm or sole, you can understand sometimes there won't be any color change or contusion to see from the skin. And also with greater volume of fat what will happen? More contusions. And also in children and also in elderly people, you get more contusions when compared to a younger person because of the softer tissues. an area of the body. So this is again very important to understand. Now if you get a force applied to abdomen or buttock where you get basically fat tissues, right? So lots of fat tissues. However, if you get any other area where you get a bony surface underneath, right? So when you compare these two areas, you get less amount of contusions here, but because of the anvil action by the underlying bone, you get more contusions here. So what's the medico-legal important aspect here? What are the examples of these bony areas? Maybe chest, head, shins, right? Now abdomen and buttocks. What will happen? Now there may be severe internal injuries without any external injuries in the form of contusion. Remember, now abdomen and buttocks, right? So you will not get sometimes injuries in the form of contusions because of the thick fat layer, but there may be severe internal injuries. So you have to know about that part. And also depth at which the bruise is placed. Now again there is another important thing that you have to understand, right? So now imagine the contusion get in deeper areas, right? So what will happen? So we can't see anything from all the layers, all right? But with the time, so now you know this is extravasation of blood, and also the color will be changing with the time with the degradation of hemoglobin. So there may be color change gradually that will come upwards to see through the skin with the time only. So this is one thing that I want to tell. The second thing, there may be deep contusions where you can't see at all. You only experience pain and other clinical symptoms only, right? And also the appearance of a contusion always depends on the volume of blood loss in a given area. The intensity of the injurious force. Now again this is very common sense, right? So however, the size of the contusion does not depend on the severity of the force. You can understand, right? So again, because of the bleeding disorders, age and the area, right? So now the size does not depend on the force applied. And also the complexion of the person, you can understand sometimes it will never appear with very dark skinned person. Right, so delayed appearance we have described. And the next important thing is movement of bruises, right? So now as you can understand, by definition you get the extravasation of blood. When gravity is applied through the tissue planes, what will happen now? Even though, so this is a bite mark, right? So with certain contusions as well. Now because now because of the extravasated blood along the gravity, what will happen? So this is elbow, all right? So this is arm, this is forearm, this is elbow. Now with the gravity, what will happen? You get accumulation of blood along the layers of tissues, right? So later on you get the color change. Actually speaking, you get the trauma here, but finally you see the color change here, right? So that's why now the first of all we have described about the size actually not reliable, and at the same time sometimes the site is also not that reliable. So what are the places that you get such kind of movement of contusions? Usually upper arm, and also thigh you get injury, and finally you see the contusion over the knee. And the commonest one is forehead injuries, and you get black eyes because of the seepage of blood up to the eyelid. We have discussed about bite marks and bites. All the bites are not only contusions, but there may be abrasions and even lacerations as well. With love bites or suction bites, there may be contusions. Moving on to the black eye. Now, there are three kinds of black eyes that we have described during the head injury part. It is not always due to direct trauma, as we have clearly described. There may be two other mechanisms as well. Have a close look of these images. As you can see here, you can see bilateral black eyes. How do you describe it? Is it due to direct trauma? Is it due to anterior cranial fossa fracture? What would be your explanation? Here also you can see unilateral black eye. So this is due to the direct trauma. And here also it is due to direct trauma. You can see certain abrasions and little injury here as well, and also a covered injury there as well. So what are the mechanisms that could cause this kind of black eye with subconjunctival hemorrhage? What do you think about the subconjunctival hemorrhage? Can you see the posterior margin here? No, you can't see. Now I am going to emphasize one fact here. If you can't see the posterior margin in the subconjunctival hemorrhage, it is suggestive. It's only suggests, right? So it is suggestive of anterior cranial fossa fracture, where you get seepage of blood. See as subconjunctival hemorrhage. But obviously in this case it's not anterior cranial fossa fracture. Here it is due to direct trauma, as you can see here certain other injuries as well. But imagine now, if you can see injury here, a large laceration like here, now it could be due to the seepage of blood. Now this is a very nice example. You can see bilateral periorbital hematoma, and usually we name it as panda eye sign or raccoon eyes, due to the seepage of blood from the anterior cranial fossa fractures. Right. So now what are the three mechanisms? Direct blow, as you can see here very nicely, and the second one is some kind of injury, could be contusion or laceration on the forehead. With that trauma you get seepage of blood and you can see periorbital hematoma or periorbital contusion. The third mechanism is bilateral anterior cranial fossa fracture causing panda eye sign or raccoon eyes. And the next important thing that I want to highlight is with black eye or periorbital hematoma, it's your duty to examine about the possibility or a possible subconjunctival hemorrhage, as you can see here. If you can see a subconjunctival hemorrhage, your next duty is to see the posterior margin. If you can see the posterior margin, it is more towards a direct trauma. As you can't see the posterior margin of the subconjunctival hemorrhage, it is suggestive, it is only suggestive of fractured anterior cranial fossa fracture. Can we see postmortem contusions? Yes, of course, but there is an important point to understand. With the death, no vascular pressure inside. So to cause bleeding with the rupture of a vessel, there should be a huge pressure. So even with a huge pressure, you get only a very small contusion. So simply telling, yes, postmortem contusions could occur, but it is necessary to have a very large force. Internal contusions, yes, we have described enough it. And now moving on to the histology. Right, so now this is the blood vessel. By definition, to get a contusion, there should be a traumatized blood vessel causing extravasation, infiltration and coagulation of the blood vessels. So if you see microscopically, you can see traumatized blood vessels and also extravasated blood, red blood cells as well. Moving on to a case of hypostasis now. What do you mean by hypostasis? So with the death, what will happen? There won't be any pressure or pumping blood inside the vessels. Now what will happen with the gravity? All the RBCs are going to be settled within the vessels. No trauma to the blood vessels, but red blood cells are going to within the blood vessels itself. But we can see this accumulation of blood vessels through the skin as a color change that is pink in color. So now if you look at such area, if you look at on such an area, what do you see? You see red blood cells within the blood cells, within the blood vessels, not on the surrounding tissue, right? So as a result, by having a microscopical evaluation, you can differentiate true contusions from hypostasis. Now here you can see a lot of photographs. Here you can see very nice hypostasis and cut section of the left ventricle. With that you can see an area of hypostasis. You can easily mistaken this one with acute myocardial infarction, right? And lungs. So these are the posterior aspects of the lung. So this is the right one, this is the left one, where you see a very good color change here, right? So this area is pale when compared to this area. So this color change is only due to the collection of blood, that is hypostasis. So this is cut open esophagus, where you see congested area here and two paler areas. So these areas, this is due to the pressing of the pharyngeal area. So this is the pressing of the carina. Now you can understand, so we can get certain post-mortem artifacts that mimic contusions. Here you can nicely see now to appreciate the paler area and the congested area that mimics a contusion. Now here is a table, leisurely you can go through it, how to compare hypostasis and a contusion. So what are the important ones that I can just explain? What do you think? Can we wash contusions? Not really, because it is the infiltration, coagulation, right? So now we can see a kind of vital reaction there. When compared to that, in case of hypostasis, we can wash it away, right? So this is one of the methods that we can use to differentiate during the postmortem examination, that means hypostasis and the contusion. Moving on to the practice MCQs regarding contusions. Contusions are caused by desquamation of epithelium. Totally incorrect, right? So skin should be intact. The color change is due to the drying of the epithelium. It is in abrasions but not in contusion, so it is incorrect. The color of contusion is reliable for estimating the timing. It's incorrect. It's not reliable at all, but it gives a kind of clue. Contusions are seen only on the skin. Again, incorrect. You can see internal hypostasis, internal contusion as well. A contusion may not appear at all when deep-seated. Yes, that's true. I have explained it. When it's very deep-seated, sometimes it will not appear. Sometimes with a time, it will appear. A large contusion indicates a large contact area. No, it's not correct. The reason is we can't tell about the force applied by appreciating the surface, because it's extravasation, infiltration and coagulation of blood, and also there may be human factors such as coagulation problems and things, right? So the size is not a real indicator. A contusion is a reliable feature to determine the site of impact. Again, no, as we have clearly described, injuries to thighs and also arm and also forehead, there may be seepage of blood changing the original place. Postmortem contusions are unlikely. No, it's incorrect. Contusions on palms and feet are easily caused. No, because of the tightness of the tissues, you won't get contusions easily. So this is incorrect. Periorbital hematoma needs direct contact. That's true, but not always, but this is also true. Tramline contusions are a result of broad surfaced flat weapon. No, it's not. It is caused by rectangular object or maybe a pipe-like object, right? So it should not be broad surfaced flat weapon. When deep-seated contusions take time to appear and re-examination is essential, right? So now as I have explained, right? So re-examination is a must in case of torture victims. There may be later appearance of contusion. So if you are not going to do it, it is actually a kind of negligence. Remember, battle sign is due to involvement of the mastoid process region and represents a contusion. Yes, this is again due to the fractured basal of skull and seepage of blood. Because of this fracture and the injured tissues, there may be seepage of blood up to the mastoid process to see as battle sign. So this is correct. Panda sign is the result of bilateral anterior cranial fossa fracture. It's true. Pattern contusions give a clue to the causative weapon. Yes, that's true. Pattern contusion caused by sharp cutting weapon injury. No, it's definitely incorrect. Contusions, a mechanical blunt force. Tramline contusions with sparing at recessed areas are suggestive of a pliable weapon. Right. So now I am going to explain it. Imagine a back of the chest where you get a recessed area. Now if I have a cut section like this, right? So now this is the recessed area. So if you get a shot like this with a pole, what will happen? Now there is a spared area of the body because of this recession. But if the weapon is a pliable one, what will happen? Now because of the pliability, the weapon will move up to the recessed area as well to cause a continuity even on the recessed area. That means the tramline contusion, right? So now the explanation is, if you happen to use a rigid object on recessed areas such as back of the chest, the contusion is actually not a continuous one. Here you can see if this is the back of the chest, if this is the center with the recession, right? The contusion will be like this. You can't see the contusion here. But if it's a very pliable one, a belt example, it can cause continuous tramline contusion, right? Now, tramline contusions with sparing at recessed areas are suggestive of a pliable weapon. It is incorrect. The other way is the correct one. Yellow color indicates that the contusion is at least 18 hours old. Yes, correct. Contusions are commonly seen in self-inflicted injuries. It is incorrect. Usually self-inflicted injuries are abrasions, superficial, very minor injuries, not contusions, because to cause contusion should get very much force and it is very painful. Absence of contusions on the abdominal wall excludes serious underlying injuries. Definitely it is incorrect. So you always have to know this fact as a practicing doctor. Even without a scratch on abdominal wall, remember there may be serious injuries inside the abdominal cavity, right? So though you can't see any contusion, right, you are not going to exclude any internal injury. So this is incorrect. Green color of a contusion is due to bilirubin. It is incorrect. It is due to biliverdin. Panda sign is the result of bilateral anterior cranial fossa fracture. It is correct. The size of a contusion is always proportional to the force applied. It's not correct. Contusions can occur in internal organs without any external bruising. Yes, that's true. Yellow color of a contusion appears within a few minutes of injury. It is incorrect. At least you have to have 18 hours. Pattern contusions can help identify the type of the weapon used. Definitely correct. That's why it is termed pattern. Contusions are more easily produced in areas with underlying bone. Yes, correct. That's why on abdomen you won't get contusions easily. Postmortem hypostasis can be easily confused with true contusions. Yes, that's true. That's why we described about how to differentiate with the table, how to differentiate a hypostasis from contusions, right? So this is correct. Microscopically, a contusion shows red blood cells in tissues and ruptured vessel walls, right? It's correct by definition. Hypostasis is often mistaken for contusion. Yes, possible. Hypostasis in the heart wall may mimic acute myocardial infarction. True. Lung hypostasis may mimic pneumonia, and at the same time, bowel hypostasis sometimes mimic bowel gangrene as well. These are correct responses. Microscopy is helpful to differentiate contusion from hypostasis. Yes, it's correct. Thank you.